One day one patient came, very poor man. His blood pressure was very high the previous time I had seen him. I had examined him, patted him on the back and written 10 milligrams of propranolol. Next time he came, his blood pressure was down. The patient did not take the treatment, but the blood pressure came down. Like this 1 year I observed, a lot of people without drugs blood pressure came down. Tomato, okay? One good tomato, fresh tomato, contains about 25 milligrams of vitamin C. You give one tomato every day to a human being, every day religiously give tomato to a human being. Biopositive. In 5 years' time, his chance of getting cancer goes down by about 50%. So you say, as you have been doing, what does tomato contain? Vitamin C. I'll give vitamin C. So they gave 500 milligrams of vitamin C for those people. In 5 years' time, their chance of getting cancer went up 5 times. Do you get this idea? In short, nature provides noni fruit, not for you to analyze it and find out what chemical it has got and give the chemical to the person, but noni fruit as such, because then the fruit, other than one chemical or two chemicals that you know, there are millions of other chemicals which do synergistic effect on to make it very effective. So any chemical in a larger dose, any chemical for that matter, killing. I tell you my own personal experience. In the 60s, when beta blockers, there's a drug called beta blockers, which your vice chancellor will tell you, was first invented by a man called Professor Barrett in France. I had gone to his first meeting in 1962 in Paris, where the man was saying, look, this is a beta blocker, it will block the beta system. So, hypertension gone, heart disease gone, world will be a happier place, and you don't have to worry. And this is propranolol. But if you give me a small side laboratory and a test tube and a Bunsen burner, I can take a methyl group, make another lol, propranolol, sotalol, mother lol, or whatever lol you want. And companies made all lols over the years. Oh, so many lols: atenolol, propranolol, metoprolol, bisoprolol, bindalol, and all kinds of lols. And every company sold it. Thousands of people got it. Now we know all these lols have killed a lot of people. Because we have given big doses. When I was in Harvard, we used to give 240 milligrams of propranolol for a patient with high blood pressure. Then I came back to Bangalore, working in a government hospital. One 240 milligram tablet will be bought by the government once in a year. So you have to fit a small bit of it. So I used to give 10 milligrams. What a good effect, do you know? The blood pressures came down so beautiful. You give 10 milligrams of propranolol, pat him on the back and say, don't you worry, your blood pressure will come down. Next time he came, Sorry, sir, waking you. Now coming back to our propranolol, what happened was 10 milligrams did the work. So I used to write there in the case sheet, I only gave this man 10 milligrams. His blood pressure came down. So every patient I used to write like that. If I had seen 4 patients in a day in Harvard, I used to see 400 patients in Bangalore because our patient load was so big. And we had hardly 1/100th of the number of tablets available in Harvard. So what happened was, one day one patient came, very poor man. His blood pressure was very high the previous time I had seen him. I had examined him, patted him on the back and written 10 milligrams of propranolol. Next time he came, his blood pressure was down. So I said, hey, beautiful. I asked him, you're a very good man, you're very faithful, taken my drug. He said, yes sir. And I again wrote to him and wrote to him. While going, I saw a little bit of his mouth coming out like that. So I called him back. He said, why? What happened? No sir, you wrote yes. But when I went to the pharmacy, they said there's no stock for the next 6 months because budget comes only in March. It is over in April. And then from April onwards till next March, there is no drug. He said, is it true? Yes. Then I went to the district surgeon. He said, yes, we don't have the budget. What to do? So I wrote, the patient did not take the treatment, but the blood pressure came down. Like this 1 year I observed, a lot of people without drugs blood pressure came down. So I wanted a new study which is called Intermittent Treatment of Hypertension Crossover Trial. This was unheard of those days. What I did was, I bought myself some propranolol from the market, cheap propranolol. and then some diuretic from the market. And we had two outpatient departments, Monday and Thursday. So I used to give one tablet of that on Monday, not give it and send him, put it in his mouth, tell the nurse to put some water, and see that he swallows, and look at his mouth very carefully that the tablet is not in the mouth. Sometimes they can keep it here and then swallow and show you that nothing. All that we did. Then check their blood pressures. On Thursday when they came, first thing was blood pressure check, because you can say, oh, he took the medicine on Monday. And the blood pressure continued to same as the other group. I gave them every day, same treatment. One group Monday, Thursday, one group every day. At the end of 6 months, I crossed them over. The alternate group came to daily group came to alternate group. So that you are not comparing different human beings, you are comparing the same human being. This is called a crossover study. This is the best study that you can do. At the end of the day, both were wrong, same. So I published this data in London. I went for a meeting. The abuses I had was something, phenomenal. 1972, I was very young. I also had little hot blood, but you can't have hot blood in London. So they said you're a bloody fool, you should be in jail, unethical, unscientific, uncouth. I know all kinds of adjectives that they knew. I don't know that many adjectives in English, but number wise, it's always a problem. If I want, I can really use the best epithets and scold them. All that happened. This was done by a man called Colin Daldry. He was a big man. Colin Daldry was the professor of clinical pharmacology in the Hammersmith Hospital. Such a big man. I was a puny little fellow from a village. So I kept quiet, swallowed all that, and came back. There was one professor of pharmacology in Royal College in Ireland. His name was Kevin O'Malley. O'Malley. O'Malley in Irish is son of Mary. O''Malley, son of Mary. O'Malley wrote to me, look, I have observed something very interesting. It may interest you. I used to give a drug called hydralazine, whose half-life is about 3 hours. That means you have to give 3 doses every day to the patient. We used to give 3 doses of hydralazine for pregnant women, etc., to bring the blood pressure down. He gave 1 dose of hydralazine to a rat, hypertensive rat, and when the pressure came down, he didn't give hydralazine for, and continued for 150 hours. 150 hours. How many days? 24, 4, 24, 4, maybe about 2 weeks. Then the blood pressure started going up, he gave another dose. So he said, I have known this happening without pharmacodynamics, pharmacokinetics, blood levels, and blah blah blah, whatever we teach students in the pharmacology class. All that is nonsense. So I picked up Kevin O'Malley's paper, put my paper together, and rewrote another paper. By this time, the Western world realized there's some truth in it. And there is a man called Michael Alderman, who is professor of hypertension in New York University. He wrote an editorial in the American Journal of Hypertension 10 years later that probably intermittent treatment, step-down treatment will be the future thing. 1993, I wrote a book on hypertension where I mentioned all these things. And now I read the book. Book looks very, very new because all the modern drugs that came after that have killed more people. And the latest Al-Hart study is the largest study which studied 64,000 patients, showed that most, if not all, anti-blood pressure drugs have killed more people than they saved, except diuretics. This is what I wrote in 1993. Same sentence is there in my book. Now we have to go for a small dose. This 4 meses is a science you have to remember. So